Under the Biden administration, the United States has led the global coronavirus vaccination campaign to combat the pandemic, with more than $1.6 billion committed, nearly 300 million vaccine doses donated, and more than 800 million additional doses pledged. Our country leads all others by a significant margin on all of these metrics. And we have called on our international partners to do more to address vaccine inequity. Now, Dr. Khan, what would you say are the benefits of America's leading contributions to global vaccination efforts?
Mr. Chairman, as we heard very eloquently from our economic speakers also, there's no doubt that in the United States, because of the failure to get this pandemic under control, we still have healthcare rationing going on. We have schools, businesses, et cetera, disrupted supply chain, but that plays out globally also. And if we want to protect people, we have to protect everyone. Otherwise, we will continue to have new variants emerge and make their ways onto our shores and force us into another cycle of aggressive prevention strategies. So yes, the US has taken the global ship role, which is necessary, because then that allows us to work with other partners to say other countries need to step up also and continue these efforts to increase both vaccine supply, vaccine access, and to address the misinformation that's rampant in the United States. We see it all the time here in the US, unfortunately, and it's now made its way worldwide with increasing vaccine hesitancy. So we need to address all three of those issues. And as I said during my testimony, we answered this question with the HIV pandemic when we said profit will not trump lives. And those were the decisions we made then to make sure that HIV treatment was available to everybody worldwide. It's a simple decision for us to make now. The US owns the Moderna patent, and it can clearly make it available to the global community. Their WHO has set up an mRNA technology hub that's ready to make this happen. So it's not a matter as if countries could not scale up if they were not issued these license and assistance with know-how. They clearly can scale up. We can have national hubs that are producing vaccine, get us closer to getting a global community vaccinated and get to a post-pandemic phase.
Very much for that. I know that we're going to be a bit convoluted as we go through this today. So it's Mr. Jordan. I don't see him. I want to go